You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, the keys to a natural-looking facelift. My first guest is the author of Creating Beauty. This doctor is world-renowned, lectures nationally on how to achieve a natural-looking facelift. So if you are unhappy with the way you are aging, my advice, stick around for the latest edition of The Wellness Hour.
The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of facial plastic surgery. With us, we have board-certified facial plastic surgeon, Dr. George Brennan. Dr. Brennan, welcome to the program.
Thanks so much, Randy. Nice being here.
Now, we've wanted you on the program, and that's a fact. We've been trying to get you on the show for the last 5 years, so I'm really privileged to have you on the show. Now, before we get into today's topic, tell me a little bit about your practice. I guess you have a medical spa, and then you have the, surgery center?
We have the medical spa where we do all kinds of non-surgical treatments like laser resurfacing and rejuvenation. We do the full gamut of injectable fillers. We do treatment of overactive facial muscles with the use of Botox. And the med spa is a place where we do non-invasive facial rejuvenation.
Okay.
And we do what has commonly been known as the liquid facelift.
Liquid facelift.
Yeah.
Okay. Okay. Now, the surgical side. You know, because you're known for your facelifts. I guess internationally. I mean, you lecture on the topic to doctors about this topic.
I've had the opportunity of lecturing to literally thousands of doctors, not only in this country but in many other countries abroad.
So you've written a couple of books too. I guess one for the public.
Yes.
Right, and then a medical text. And if the public reads this, what happens?
They'll be totally confused.
They'll be confused. Okay.
In fact, that's why we wrote the latest book, is because it's designed for the lay sector, and it's designed for the common person to pick up that book and really understand what the field is all about and what we can accomplish realistically and what we can't accomplish.
Now, other surgeons consider you an innovator, pioneer. I mean, you've invented, I guess, the hair-sparing facelift, this liquid facelift. I mean, the list goes on and on. You know, brow lifts. Is it endoscopic brow lift you're responsible for? What is it?
Well, actually, we've gone a step further, and it is now called a non-endoscopic brow lift. And it's performed literally through 3 1-centimeter incisions. So it's minimally invasive, and it's just a very, very innovative, unique procedure.
You know, we should mention, you're also board-certified otolaryngology.
Right.
And that's ear, nose, and throat. Does that
Yes.
make you a better surgeon for facelifts, and if so, why?
Absolutely, because, see, part of ear, nose, and throat is facial plastic surgery. Okay. And that's where we got our start. And then we did special training in facial plastic surgery and then in cosmetic surgery.
Okay.
And so that our training is tremendous in depth, and that benefits the patient.
Now, you're being humble today, but we talked on the telephone. You say, Randy, people come to me because they want a natural look, a natural facelift, one that nobody notices. And I said to you, I feel like a connoisseur after all these years and looking at facelift photos where I could spot a good facelift, about 10 yards away.
Well, if you can spot a facelift, it's not a good facelift.
Okay.
Yeah, because this is really like a world of magic, and the magic of
magic. How so? How so?
Well, because if you do surgery properly, a person's friend can look at them. They can know they look better, but they won't be able to know why. And it's just like if we see a magician.
Yeah.
We know he's doing magic, all right? But if we can see what he's doing, it's not a good magician.
Yeah. So your best work should go unnoticed. You believe that?
Absolutely.
Okay.
Without a doubt. It should be natural. There should be no hair loss. There should be no visible scars, no pulled ears, no wind tunnel look, no shock eyebrow look. Very, very natural results.
Okay, now it's men and women that are going to you for facelifts. Is that right?
About 20% of our patients are men, and that keeps increasing in numbers over the years. But by all means, a lot of men are having all kinds of cosmetic surgery from head to toe.
Now, the facelift has become more mainstream. We know liposuction, I guess breast augmentation, you say, is very popular, but the facelift is now becoming almost as popular as those procedures. Is that correct?
Well, it's true, but I can tell you that the classical facelift that required a lot of incisions is really being replaced by the more modern facelift, where people start earlier, they do shorter procedures, less invasive procedures, less conspicuous procedures. That ties us into the med spa, where a lot of facial rejuvenation is done by replacing volume in the face.
So you do all the fillers and things like that? I mean,
Yeah, absolutely.
everything you do. Okay.
All the fillers, all the skin rejuvenation, reversal of sun damage, and really remarkable, near miraculous results.
Now, the facelift patient you see, so it's more women than men. What do they say to you? I mean, what are their reasons why they want to do something? And what are their fears?
We're really blessed in our field because we're not dealing with sick people. You know, so it isn't as if our patient has a broken arm or a tumor or some horrible disease. They simply don't like what the mirror is telling them. And so the beauty of our field is that we can have a honest exchange with the patient, put them in front of a mirror, have them tell us what bothers them about their perception of their own appearance, and then we can give them a menu, if you will.
Really?
And we can say, well, these are the things that you can consider doing. All right, and then it's up to them to study their own face, and whatever they decide to do is what we do.
What do they want, by the way? I mean, do they want to look prettier? They want to look younger? They want to look rested? Different? They want to look different? What do they say?
The best patient is one who simply wants to look better. It's not, we're not, this is not reincarnation, it's rejuvenation. The way we like to do it is to let a patient know realistically what can be achieved, and then it's a decision between them and the mirror.
Let's start then with the aging face, the way you look at an aging face.
First of all, you have to understand beauty, and we can actually define beauty. And I brought some photographs to show you what I mean. Here is an example of what creates beauty. Now, if I show you model faces, whether they're men or women, GQ, Vogue, whatever, there are certain definable traits of a beautiful or a handsome face. And as we're evaluating a patient, we're saying, what is it about this face? Do they need more volume? Do they need more structure? Does their hairline have to move? Do they have excess skin? There are so many factors that go into creating.
So you do these consults. I mean, you do this with the patient, one-on-one. You do it?
One-on-one, absolutely. I do it with the patient, and we start by looking in a mirror and
I mean, you show them things like you're showing me and say, look, this is what defines beauty. This is what needs to be done. Does this conversation go on with the patient?
Absolutely. The conversation goes on, and we use that book that we wrote as a vehicle to educate the person as to what can realistically be achieved. And sometimes they look at those photographs and they're just blown away. They really can't, they're astonished by the results.
So you've analyzed the face, you've talked to the patient about what you're trying to accomplish, and then what?
And then we give them their choices, and we can say, well, this is what you're going to look like if we raise your brow. This is what you'll look like if we change your nose, and so on. Now, here's a patient who came to us, and she happened to be a ski instructor in Aspen. Here she is living in the altitude close to the sun, beating up her skin, so she shows a lot of sun damage in addition to all of the structural changes and the beginning aging features of her face. And so now we talk about three different things. We say, there are certain things you can do that are going to be improved only by surgery. Number two, we're going to relax your overactive muscles. And number three, we're going to rejuvenate your skin and reverse the sun damage that you've incurred living close to the sun.
So when you look at this woman, what does she need when you see her? I mean, when you look at that, you think, okay, she needs a facelift, because you did a facelift on her.
We did a facelift, but I should point out that, see, years ago, a facelift was simply making an incision and releasing the skin and tightening the skin and praying that you got a good result. Okay.
All right.
Well, that's
is that an exaggeration? I mean, that really kind of went on.
No, that's true. That's very true.
Does it still happen today?
It happens today. Yes, in unsophisticated hands, that's exactly what happens. All right. And so now we had an honest discussion with this patient, and we said, here's what could happen to you if we changed your eyebrow position, if we cleaned up the extra skin around your eyes, if we did a minor modification to your nose.
So you didn't like her nose?
More importantly, she didn't like her nose. And what happens is that when she smiles, her nose looks even longer, which makes her look older and less attractive. So she wanted a more youthful, natural-looking nose. Another thing that was bothering her is if you see this line that goes from her nose
those lines
down to
around
her
your
lips.
mouth.
Exactly.
Now, when you see this, by the way, as a surgeon, like this, do you see the end result? When you see this, you go, boy, this could be a great result. Does that go through your mind?
Well, it must go through your mind. If you're going to get good results in this field, you have to
see it.
You have to imagine it. Absolutely.
You've done thousands of facelifts, by the way.
Literally thousands.
Is that true?
Yeah, literally thousands.
Is there a huge learning curve? I mean, are you that much better? It seems like an obvious answer, but I mean, are you that much better now than you were, 1,000 facelifts ago?
Honestly, I do believe that I learn every single day. I don't think you ever stop learning in this field. And there's always something new.
So your last facelift was your best facelift?
It was.
You think so? Okay, so this woman, you saw the end result. What'd you do?
Just look at the after, and
Wow.
it's actually hard to believe
Doesn't look like the same person.
that this is the same person, but yet it is. And yet it's done in such a subtle way that her friends know she looks better, but they can't really put their finger on why she looks better. But look at the dramatic result that we achieved.
She looked almost
right?
angry or serious in the before. I mean, that looks also very sophisticated.
Right, and what's important is that you do it by making very, very subtle millimeter
What
changes.
does she say after, after it's all done?
Well, in her case, she told me that she was closer to cloud 9 than she was normally in Aspen.
All right, okay, so what are we looking at the next one? You say you do the hair as well.
Hair is very, very important. Now, you can see that this girl has a very, very high forehead hairline. Now, if I
Is that common, by the way?
It's actually very common in women, yes.
They just
and
hide
women, they hide it using hairstyle. They wear bangs and they use camouflaging hairstyle.
Right.
Now,
so what do you do? How do you do that? That's not like a hair transplant.
And it's not a hair transplant. It's by making an incision right at the hairline and mobilizing the scalp, and bringing it forward. But what's amazing is that you can get very, very
Is that a straightforward, pretty easy for you to do?
It's a very simple procedure to do.
Wow. What do they call that, by the way?
It's just a hair lowering procedure.
Hair lowering procedure. Okay. Now you have a young person there?
Here's a girl with prominent ears, and afterwards her ears are in normal position.
Makes a big difference.
Huge difference. Now here's a girl who is about to get married, and what she didn't like was the bump in her nose, and you can see by just a very, very subtle change.
But you also lifted the tip of her nose as well.
Just a fraction. Once again, what's important is that if you look at this after photograph, there is no way for you to tell me that she ever had her nose done. Okay. And that's what we consider to be a successful surgery.
You say they become more outgoing, their personality shows more. You fix something and they change. Changes in personality?
Oh, it increases their self-esteem tremendously. And we all know that beauty is so important in our culture.
Okay.
And
what's wrong with aging gracefully?
Well, the way to age gracefully is to have cosmetic surgery.
Is that right?
That's right.
Is that the new thinking? Interesting.
That's always been our philosophy.
Are you half kidding, or you believe that?
No, I do believe that.
So aging gracefully now is finding a good surgeon that could create a natural face.
Without a doubt.
Good. Well, we broke the story here. This is good. This is good. What are we looking at here?
Okay, so now if you look at this male and you say, well, really, what's wrong with the male? But if you look closely,
pretty good.
you see that there's little or no upper lip.
And that bothered him.
That bothered him a lot.
Oh, really? Okay.
Yeah. And so we developed a procedure years ago where we do what's called a lip lift, and you can see now in the after photograph
there is a difference. When you look at the mouth in the before and after.
But most importantly is if I ask you to detect a scar,
yeah, where is it?
You're not able to detect it. And the incision is right at the border of the pink and the white skin of the lip. And that incision happens to heal very, very well.
You invented that procedure.
I did.
And I've never heard of that before.
I did.
Is that something you do frequently?
We do that in about a third of the patients that we operate on.
Okay. So we have some necks.
Okay, so now we're still talking about structure. Now this is heredity. See, a lot of people think that this is age-related, but it isn't. And if you look at the fat in that person's neck, he inherited that from his father.
Okay.
All right, and he just could not stand looking at that in the mirror.
Couldn't stand looking at the neck.
Yeah.
Okay.
And so through a very, very simple liposuction procedure, now we did simultaneously do a minor facelift on him, but the main thing is that we eliminated the fatty tissue, so now he has a much better neckline.
Yeah, you kind of squared out, gave him that look. Very, very strong, very good look. We have time for one more before the break.
All right, now this is frankly, in my mind, a very remarkable case, because this girl came to us, and she, if you can see that she has fat in her face and in her neck and a receding chin, and
so what didn't she like?
What she didn't like is that she felt that she was unattractive. Okay, now what's really remarkable about a case like this is that you don't have to do drastic changes. All you have to do is contour the fat in her face, eliminate the fat in her neck, build up her chin, and this is all millimeters. But when you add all of those things together, you can get just absolutely dramatic results. Yeah, and I
mean, now she's a bombshell. I mean, she looks very pretty.
She is today she is a very beautiful girl. And now you can see that she has a very well-defined jawline.
People have to treat her differently.
No, without a doubt.
Did she tell you that? I mean, when you see this woman on the street, it's not even the same person.
Yeah, and the results sometimes are so dramatic, and yet, if you look at that patient, it isn't as if she looks like a different person. She just looks more beautiful.
Okay, so this is a case of somebody that don't want to look younger. You want to enhance beauty.
Exactly. This has nothing to do with age. This is structure, and we're creating...
Somebody that genetically didn't have it.
Exactly. And now all we're doing is creating beauty.
Okay, we're going to take a quick break. More, and you have a lot more photos that are really good. You're watching The Wellness Hour, leader in medical news and information. We're here with Dr. Brennan. We're talking about the keys to a natural-looking facelift. We'll be right back.
Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light super activates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
Tried all sorts of cover-ups for bad breath? Try the science of BreatherX. Only BreatherX has Zytex. It attacks the cause of bad breath, keeps working for hours. It's clinically proven for real fresh breath.
Get non-prescription BreatherX from your dental hygienist and now at fine stores everywhere.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, the keys to a natural-looking facelift. Here we have world-famous Dr. George Brennan. Okay, Dr. Brennan, you know, we've talked, for people just tuning in, author of 2 books on the topic, medical textbook, you know, plastic surgeons, facial plastic surgeons from all over the country, cosmetic surgeons. Here you speak about how to create a natural facelift. That's fair to say?
Yeah, that's very,
I spoke to your wife. She says he doesn't like to brag about himself. So you're a very humble guy. But I guess you know, when you look at pictures like this, they speak for themselves. I mean, this is very, very good work. And to recap the last segment, this woman just had a little bit of neck lipo, chin implant, and volume from her face. Okay, so what are we looking at here?
All right, well, so far we've talked about structural changes. So we have created beauty. All right, so now we're going to talk about rejuvenating the face and try to maintain their beauty. And so here's an example. Now, what I want you to do is concentrate on her eyelids.
Yeah.
And you can see the tremendous...
heavy.
Yeah, the tremendous hooding that actually restricts her vision. All right. Now, one of the procedures that I designed is the non-endoscopic closed brow lift, and it is a minimally invasive procedure. It takes about a half hour, very little downtime.
So with this woman, when you see her, brow lift and the skin over the eyes.
Yes.
And you call that a blepharoplasty.
A blepharoplasty.
Okay.
So now, if you look at her after, you see her brow is in a good position.
Very nice.
Yeah, she has a very well-defined cleft of her upper lid. It's one that accepts makeup. If you look at her before, there is no chance
She
that
has
she
to be
can
thrilled with that.
She has to be thrilled. Now, a big question in our field is, does that procedure work?
Does it last?
And I can tell you.
You mean it may fall?
Exactly. Now, some people will say, well, that procedure is not going to last very long.
I've had plastic surgeons on my show saying that they don't like it because it falls.
All right, well, now I'm going to show you a photograph. This is that same patient 15 years later. You know, if we can do procedures on patients where in 15 years they look better than when they first came to us, then we've really accomplished something. And you can imagine...
Another natural looking...
Exactly, and you can imagine how happy that patient is.
So very subtle, what you did there.
Yeah, and subtle is the key, because if you overdo it, you end up with this wide-eyed look, a high eyebrow, this shock look. That defies the whole concept.
Especially for men, by the way, because it can feminize a man. You do a lot of men?
We do a lot of men. We do 20% of the patients we operate are on men. And if we have time, I'm going to show you some.
All right. We have time for a few more because we're just about out of time. What are we looking at here?
All right. Now, here's a woman who came in, and she just had an unhappy look. And the reason is that she inherited this fatty tissue around her lower lid, and it gave her that shadowed look. Her nose was a little too long. So what we did is we just freshened up her eyelids.
Very nice.
And just shortened her nose very subtly.
Now, when you put these side by side, I mean, what a huge difference. Number one, on the after, she looks much prettier, and she looks literally exhausted in the before.
And without a doubt. And you know, and Randy, you can just imagine if this person compared to this person went in for a job interview.
Okay.
Who would get the job?
Interesting point. Yeah, just because one looks like they're more motivated.
They look, well, she not only looks more motivated, but she looks fresher, she looks happier, she's going to relate to people better, regardless of what field she's in, and I guarantee you that she has a better chance of getting the job than she does.
Now, I mean, do you think you could actually slow the aging process? I mean, you start early with these procedures in your 40s, or when you start showing aging, you could kind of slow the appearance of aging if you do all these procedures?
Well, I think what we need to understand is that aging happens at different chronological age, and some people at age 28 show a lot of signs of aging, and other people at age 58 come in for a consultation, and I don't know what to do for them because they still look great.
All right.
And so, but without a doubt, if they start early and they do minimally invasive minor procedures, especially now with the med spa, where we can use fillers and a little laser retreatment and what we refer to as the liquid facelift. It is amazing at how you can maintain a person's appearance where they look better in 10 years than they did when you first saw them.
Okay, so if I went to you for 10 years, in 10 years from now,
10 years,
I could look younger than I do now?
You'll look at least as good as you do now, which is, you know, but you'll probably look better.
Look better in 10 years than I do right now. Okay, good. Okay, so now, a male.
Okay, now the same principle applies to a male. I mean, here's a male that has a lot of hooding around his eyelids. He has the same hereditary problems where he has a lot of puffy eyelids. And so the idea is to eliminate the puffiness, clean up his eyelids. After surgery, you look at just a much fresher looking person. I mean, this one looks like an angry lumberjack.
That's right.
And this one looks like a
nice, successful CEO of a company.
Exactly, a friendly gentleman.
You know, people. You know, as I'm looking at these photos, you can't help but stereotype. On the before, he looks like maybe a drinker, or he's tired, and in the after, he just looks like great for his age.
That's exactly right. He just looks more rested.
Okay.
All right. Now, Sometimes you have patients like this. If you look at the area around her eyes, she has a very aged look at
She's tired, sure.
She's tired. She has these deep folds that go from her nose down to her lips. And you look at her neck, she has an overactive neck muscles,
right
the
there.
2 bands. That responds so beautifully to just an injection of Botox. Now,
Really?
true, yeah, absolutely. And true, we did do surgery on her. But in addition to doing surgery, we relaxed the muscles in her neck by injecting Botox.
Okay, so this is considered a full facelift.
That is
brow lift?
A brow lift, upper and lower eyelids, a facelift, and then we relax the muscles in her neck with the Botox.
Oh my goodness! I mean, this is very, very nice. Now Sheila, this could be her daughter, mother-daughter situation.
She has lost a lot of years. Yes.
And it looks natural.
Very.
You know, I told you I could spot a facelift 10, 20, in fact, 30 yards away.
Yeah.
But these you couldn't tell. It's very nice.
All right. Well, let's finish with this.
Okay.
That one of the things we did in the book is that we have 2 chapters. One is of famous faces that have actually had cosmetic surgery.
Okay.
Now, I didn't do all of them. All right. So the reader has to take a look at that, and it's really more for entertainment and for amusement. They can draw their own conclusions. And these are...
So it's Bill Clinton.
This is Bill Clinton. And so what we did is we just morphed the result to show what would happen if he did his lower
Just
eyelids.
by getting rid of those bags under his eyes.
And by thinning out the tip of his nose.
Why doesn't he do it?
Because he makes $100,000 per appearance as is.
Okay, so he doesn't need to do it. He doesn't take your calls? Is that the problem?
Yeah, exactly.
Is he an easy one for you? I mean, that's like an easy one to take care of.
That is so easy to do, it's amazing. And, you know, but again, if he's happy with the way he looks, he should just stand pat and leave it alone.
One of the things you mentioned early on the show, that aging gracefully now is good cosmetic surgery.
That's right.
Is that right?
Our opinion is the way to grow old gracefully is to have good cosmetic surgery.
Okay, but find a doctor that does the natural facelift.
Yeah,
Look at their work.
You have to find a doctor who's been well trained, has a lot of experience, and gets great results.
Okay, great. I want to thank you for coming to the show. We'll have to have you back to talk about some minimally invasive stuff in the future.
My pleasure.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.